first time in more than 50 years, the U.S. could ease restrictions on marijuana. The U.S. Justice Department wants to reclassify the drug as lower risk.
Yeah, right now, Texas allows marijuana use for medical reasons, but this move would send the drug from the most severe Schedule 1 classification down to Schedule 3. Brittany Jeffers joins us live to explain what the reclassification would mean and sort of a timeline.
Yeah, Amy and Owen, a final decision on this reclassification is likely months away, but many people discussing this, advocates say that if this were to be reclassified, they see this as a step in the positive direction. They believe in making this more accessible to the community. However, those against it say they are not in favor in changing any kind of restrictions at this point in time. So this potential change would not legalize marijuana at the federal level, but it would reclassify it. So that is what we're talking about. This means it would be reclassified from a Schedule 1 drug, things like heroin or cocaine, to then be a Schedule 3 drug, which means it could be lawfully prescribed as medication, things Tylenol with codeine. So this change, again, would not legalize recreational marijuana, but the possession and distribution of it would still be a federal crime. It would be recognized as a drug that's less likely to lead to addiction, and that change could give tax benefits to state licensed operators and potentially have a major impact on penalties and prison time. Legal reform advocate Stephanie Shepard served 9 years for conspiracy to distribute. Here's her thoughts.
What does this mean for incarceration rates in America?
Hopefully it means a step closer to lowering those rates, and also releasing those who are serving heinous sentences for cannabis.
Now, not everyone is on board with easing marijuana restrictions. Some state lawmakers are against a potential new classification due to mental health concerns. The CDC says that studies have found that the rate of marijuana users who are addicted to the drug is from 10 to 30%.
Just look at the mental health issues that we're having in the state of Texas and across the nation, right? I mean, it's really irresponsible to do this given the mental health crisis that we're experiencing. I think we're going to hold firm in the state of Texas as far as keeping it a criminal offense.
So as far as the timeline is concerned, it's really unclear when or if that policy change could go into effect, and it is likely to see some challenges from Congress. But of course, this is something that we will continue to follow very closely. Reporting live, I'm Brittany Jeffers, KPRC 2 News.